Hi, I'm Dr. Thorpe Davis. This is my brief video on surgical technique for shoulder dislocations.
Orientation for this video. Remember, this problem is when the ball comes out of the socket, the labrum rips right here and we have to reattach it to the socket. So during this video, the camera is actually up here. You're looking at the socket at the bottom of your screen. The labrum that we're fixing is over here, reattaching the labrum to the socket so the ball will no longer dislocate out the front.
Patient is under general anesthesia and the surgery is done through small holes. The glenoid is on the right, the torn labrum on the left, the humeral head is above us. First step is to visualize the tear. Second step is to use a rasp or sucker shaver to create a shelf on the socket. It's very important that this labrum be repaired up on a shelf, not on the edge. Next, a drill is used to create small holes in the socket, and anchors are placed in the glenoid. The sutures that are attached to the rivets are used to sew the labrum back down onto the glenoid. Sutures are passed and subsequently tightened. This is the 430 or the lowest anchor done first. We typically use 3 anchors per side, one at 4:30, one at 3 o'clock, one at 2 o'clock. This is the bottommost one. Next, I'm putting in the 3 o'clock anchor. This technique is nice because I can go back and retighten the lower anchor after the middle one is tightened. Some patients have tears on the front and the back. In this patient, it was only on the front. Now I'm able to go back down to the bottom anchor and retighten that. Not pictured in this video is placement of the 3rd anchor for the sake of brevity. The sutures are cut. And finally, the small incisions in the skin are closed with 1 small suture each.